All right, good. All right, we're on our last couple air quality presentations. This is Team BMIC, and they're going to go ahead and introduce themselves and everything else. As always, the recordings are available online afterwards. And we'll have one more team after this. There will be sandwiches, so probably while we're getting the other team set up, you can go out and have a sandwich. They're not here yet. So as soon as I get here, I will let everybody know. Go ahead.
Okay, so like he just said, we are the BMIC team, are from the Biomedical Informatics Department at the University of Utah. And here is what we did for the competition. So an overview of what we'll be talking about today. We're going to start with our team members' background, then we'll go into OpenFurther, our objective, the methods, our next steps, and then we'll conclude with our references. So our team members, unfortunately, they're not all here today. The ones who are myself, Nicole Burnett. We also have Randy Madsen, Peter Moe, Ram Gourpeti, and then Julio Fasili and Naresh Rajan cannot be here today. So now I'm going to turn it over to Randy to start with the background.
Thank you. Thanks, Nicole. So this is just going to give you a little bit of background on the context of kind of where this project actually fits within some of the efforts we're doing within the Biomedical Informatics Core. It's a long-running project, and one of these is to link environmental factors with clinical findings that we have in our enterprise data warehouse at the University of Utah. This is applicable to other resources and other parts of the country that would want to do this type of work. So there are various adverse health outcomes from air quality, poor air quality in metropolitan areas. So you can find these findings in an enterprise data warehouse, and we use various tools to do that. And what researchers at the University of Utah want to do is link up things like poor air quality, measurements of PM2.5, that sorts of thing, particulate matter in the atmosphere. That's part of the exposome that we would be linked to clinical findings in the data warehouse. So there are particular types of patterns that can be temporal. So when do these types of things happen, and when do we see them in hospitals, and when can we then link those types of factors to air quality indexes? So of course, air quality during the winter, we have inversions. During the summer, we have elevated ozone levels. These can then be contributing factors to poor and adverse health outcomes. And what we want to do is be able to find these use cases for researchers to then define whether or not these occurred prior to these air quality indexes going up or down. When can we then link them in the enterprise data warehouse? So it's not really understood how much causal, but we can find that there is a linkage in time when, of course, we see more increases of different types of diseases. So integrating air quality, there's some logistics around doing this. So people don't necessarily track where they are all the time, although there are some user-generated data that's going to be more and more available for particular references to spatial temporal variations. And what that means is we want to know, based on what are the findings we have available to us by air quality measurements. And there's a few stations, EPA stations in the Salt Lake Valley, but that doesn't necessarily mean that we have the granularity we need to then say, do these particular patients who exhibit these poor outcomes live in the exact areas where they're the worst? And so we need to be able to then measure against some local resources. So let's say there's some air quality measurement stations that are run by University of Utah researchers that we can then model against the EPA data that's available to us and find out which ones are available to us to use to link actually up to that clinical data. So in order to do that, we'll be using our OpenFurther technology. So what that is, it's a federating technology to take disparate resources. So let's say you have clinical data warehouse A and B. One of them, A, has a completely different model of storing how, say, patients are related to visits, are related to labs, and so forth. And they have different coding technologies for how they say these things are represented. And then B, it may be using a different standard. OpenFurther allows us to then query, using a single query mechanism, both resources at the same time and union those two patient sets together to find maybe who are unique and who are common between the two sources. Now, the second part of this, which is the longer running effort of part of the biomedical informatics core, is then to support or extend it to query environmental data. Now, environmental data can be spatial and temporal related to a particular patient. And maybe a patient can be seen at different places. So maybe we have lab results from, let's say, again, that's found in data warehouse A, and data warehouse B has the original observation from when they saw the doctor at a clinic. Then we want to then relate that original observation and that lab value or result, maybe it's even an allergy imaging study, and we want to know, did this patient live in the valley at the time when, let's say, a high or air quality was low with a high PM2.5 value? So that's our longer term effort. The shorter term effort, Nicole will actually go over a little bit later on how we're starting that process. So the longer term goal, link environmental data by using our federation technology to available clinical data warehouses. So this is a quick overview of kind of how the whole platform works. There's a federated query engine. Right now we're using an open source query engine tool, a query tool to generate a query. This is all clinically based. Find patients who have disease XY and who are this type of demographic. Then what this actually uses is some in-house technology for metadata about those data sources. And again, metadata is just description about that data, the data source. Air quality data sources are one of those. So we want to then actually use that model data to say which one of these air quality data sources is best, which fits the granularity for the different data sources that are over here. So maybe we have the air quality web service that's available to us. Maybe we have satellite-derived data or balloon weather data that can actually give us some other measurements of air quality. And that then links up with the clinical data sources. Again, all federating from a single query engine. That's the overall platform of OpenFurther. So, and remind me when we're handing off. So, what we want to do for federating air quality data using our University of Utah data and air quality and EPA data. So we want to select different cohorts of patients living in Salt Lake who have different clinical conditions, which I'll show you a couple of quick queries that we can generate so you get an idea of what we're really trying to relate. And then the temporal variations of the air pollutant concentration at that time. And again, this is dependent on what kind of data set we're using. And right now, we're talking about just values that we can derive from the EPA web service. So here's what it looks like when you want to generate a query for a clinical patient set. So this is the tool we currently use. We're going to select a diagnosis of asthma, which actually has a lot of different sub-diagnoses. It will include all of those. And right now we're getting patients related to counties from our enterprise data warehouse. So patients who have given us their location by their billing address or such. And then we want to find out when different measurements are available at the time. And right now what we've done, this was the previous effort for a seed grant from our air quality effort at the University of Utah. So we have a PhD student who's working on some quality measures, and additionally with the first round of this, it was orchestrated manually by essentially putting a query into the query engine and then getting a result back based on the time constraints that are in that query from the EPA web service to say this was the PM2.5 measurement at that time. So we found 25 patients with a diagnosis of asthma when the average was the PM2.5 of 50 micrograms. The worst inversion day on January 20th in 2014. This is the findings from what's actually in our enterprise data warehouse right now. And so what we want to do is automate this in a longer term architecture. So this is the basis of what we're talking about, being able to use different types of air quality measurements, but we want to get at a more granular level. Again, and then Nicole will go over that. So this is where I'll hand off to Nicole, and she'll talk about how we're actually going to go through and figure out which data source is available to us and which model fits best for matching those clinical findings.
Okay, thank you, Randy. So this is a map that shows the 3 monitoring stations in Salt Lake County where they do monitor the air quality. EPA has an algorithm that they use, which they validated on the East Coast for a 12 by 12 kilometer grid around the air quality monitoring station, that they can say, this is what the air quality is like at that certain location, even though it's 12 kilometers away from the monitoring station. Now, out here, we have mountains and altitude, and so we would like to take their modeling and see if it works out here. And then we're gonna work with OpenFurther to include a data model that works best for the area. So like you mentioned, the balloon gathering air quality data. So if that's the most correct data model for the area, then OpenFurther will have that data model in there for you to use for that area. Our objective is to validate, like I said, EPA's data model with our local measurements. Our local measurements are from the University of Utah Meteorology Department. Dr. Whiteman did a study that was titled Relationship Between Particulate Air Pollution and Meteorological Variables in Utah's Salt Lake Valley, and he was kind enough to let us use his data, and that is what we were validating against EPA's data. Our methods are to analyze the differences in the air quality index values between EPA's data and the local data measurements that we have. We're going to t-test using random samples of EPA's data as well as the local measurements, and then we're going to cluster and find the differences in intra-cluster and inter-cluster mean squared errors in both of the data sets. So for those of you who don't know, this is an air quality index. This is what shows us like how you calculate what is good and bad air quality. So on the TV, when they say, you know, today's like the air quality looks good, this is how they figure it out, because, you know, you can look at the calculation of the ozone today and then match it up on this grid and see, okay, it's going to be a good day because our parts per million of ozone is only like 0.010. So that's how they figure that out. Here are some clusterings. This is a seasonal cluster. So the seasons are on the x-axis, the PM2.5 values are on the y-axis. Now this was generated using the simple k-means algorithm run to the data set that we got locally here, and it's generated 4 clusters. So as you can see over here, this is winter on the far, and that has the highest PM2.5 values. This is monthly, so the months are on the x-axis. PM2.5 values are on the y-axis. It's again the same data set and 4 clusters. This is the days of the week, so the days of the week are on the x-axis now, and then the PM2.5 is on the y, same data set. And here's the trend in the years. So from 1999 to 2003, those are on the x-axis, and then the PM2.5 is on the y, shows all the years. And then this is morning versus afternoon. In the data set that we got from or the Datemans group, they calculated PM2.5 in the morning and in the night, like every day. And so it was at 5 a.m. and 5 p.m. And this just shows the morning versus afternoon. Now, the next steps for us are completing our validation. We want to validate other air quality models and then create a public repository for storing local measurements. We want to harmonize and integrate the local measurements and incorporate it into OpenFurther. Here are our references, and that is everything. Any questions? Yes?
So on the charts there, you had different colored dots. There's green and red and blue. What do those indicate?
We generated 4 clusters, and the 4 clusters are the different colors.
So the clustering application is WECA, and we just told it to use break it into 4 different clusters. It's arbitrarily colored, but 4 clusters that also happens to match later on, you can see that there may be some correlation between the fact that it automatically clusters to 4 and that there are generally 4 seasons the way it's broken up, like some of the categories in the data set.
Yeah. And then the question, just for those online, was what the 4 colors meant. Yes, another question.
In another slide, you mentioned a t-test. What is a t-test?
So Randy would probably be better at explaining that part.
Ron, actually, if you want to comment on how you want.
So t-test is a way of comparing samples, samples of data to see the statistical difference. We haven't yet performed this t-test. So we don't have to show that. But that's something, at this point, our results are at the stage where we are going to do all these 3 methods. So we don't have any results for t-test at this point.
So the basic goal of it in this case of using a simple t-test is that we want to find if there's actually anything out of that's statistically different between the clustering of what would be the EPA model interpolated data. So there's only, if you go to the slide that had the 3 monitoring stations, using the EPA model, they actually interpolate what the air quality index would be where there isn't any air quality monitoring station. And so that data has been validated against the geography and topology of the East Coast where the original air quality monitoring stations were and where that modeling algorithm was used. So we just want to find initially, the first cut of it, is there anything that's wildly different between what we have with the local data sets and this EPA data, and then move on from there.
That makes sense.
One of the findings from the Whiteman paper and data set that we are using is altitude actually plays a big factor in air quality. So, and we here have a lot of variation in altitude. So, is it straightforward? Can be straightforwardly plug in EPA's model data for the valley here? That's the ask. So, as a part of that, we are validating our local collections with the model data from.
Sure, thank you.
In the beginning of the presentation, you talked about different health effects and things related to that. I thought I remembered at one point seeing that you guys were looking at breaking those down a little bit further. Are there other pieces that you're doing related to the health care side?
So towards health, so these are actually projects that are right now going on at university. We took this as examples to develop the infrastructure. And the infrastructure itself will not be limited to this, this set of these are conditions, but you could do anything. But we are just using this as use cases for the technology development.
Is your team or anyone on your team working on any of these particular projects?
We are not on the clinical side, but for the data provision. Not on the clinical research side, but we help them in getting their hands on the clinical data and the air quality.
Anything else? Okay, thank you.
While we get switched up for the next team, there are sandwiches outside, so please feel free to go grab a sandwich. Please do eat it outside the auditorium, and then we'll get started again in about 10 minutes for the next presentation. Thanks.